Hello, everyone, and welcome to another episode of the Professional's Pulse. I am Farida Musaddi, the co founder and CEO of Alphatech Technologies Dubai. In an era where technology is reshaping the world, healthcare is delivered. Uh, Reshaping the way, healthcare is delivered, Alphatech Technologies stands out as a beacon of expertise and ingenuity. Our commitment to serving the medical field is unwavering, and we understand the unique challenges and opportunities that healthcare professionals, institutions, and organizations face. Alphatech Technologies is here to empower you with the right tools and resources. Plastic and reconstructive surgery is more than aesthetics. It's about empowerment, self discovery, and the resilience of the human spirit. Today, we meet a remarkable surgeon who possesses both extraordinary skills and an unwavering commitment to his patients. We'll delve into the innovative techniques and breakthroughs that are shaping the future of this field. Whether you're a healthcare professional seeking insights into the latest advancements, a prospective patient looking for answers, or just a curious soul eager to explore the profound impact of plastic and reconstructive surgery, this podcast is for you. So, buckle up for a series of heartfelt, informative, and uplifting conversations that highlight the art of restoration and the rekindling of confidence. And on this journey today, we have with us Dr. Milind Wag. Dr. Milind Wag is a distinguished and accomplished cosmetic surgeon with a rich history of expertise and contributions to the field of cosmetic surgery. He has consistently demonstrated a commitment to excellence in plastic and reconstructive surgery, and his impressive journey is a testament to this dedication. Dr. Milind earned his MCH from the renowned Sion Hospital in Mumbai in 1994, and his association with this institution extended until December 2005, during which he served as an associate professor. With over 2 decades of experience, he has continuously focused on various aspects of plastic surgery, specializing in aesthetic breast surgery, body contouring, surgical face rejuvenation, and autologous fat grafting. His dedication to staying at the forefront in the field is further exemplified by his active membership in the International Society of Aesthetic Plastic Surgery since 2007. In August 2020, he was appointed as a member from India on the Educational Council of ISAPS, emphasizing his global influence in the realm of aesthetic surgery. Dr. Milind has been widely recognized for his contributions. In 2010, he was honored as APSI's Ethicon Professor of Cosmetic Surgery, highlighting his outstanding expertise and teaching abilities. His passion for knowledge dissemination is also evident through his role as deputy editor of the Indian Journal of Plastic Surgery between 2006 and 2012. Furthermore, his leadership extends to the organizational level, as he served as a member of the Executive Council of the Association of Plastic Surgeons of India, APSI, from 2014 to 2016. He also assumed a similar role in the Executive Council of the Indian Association of Aesthetic Plastic Surgeons from 2019 to 2022. His commitment to promoting knowledge and insights in the field is evident as the co chairman of the editorial board for the Interactive Journal of Aesthetic Surgery. At present, Dr. Milind holds the prestigious position of president at the Association of Aesthetic Plastic Surgeons of Mumbai, Thane, and Navi Mumbai, AAPS, further cementing his status as a respected figure in the local medical community. He is also the partner at Make a Change, a center for cosmetic surgery in Mumbai. As a visiting senior plastic and cosmetic surgeon at several renowned hospitals in Mumbai, including PD Hinduja, Hiranandani, Leelavati, Breach Candy, Nanavati, and Rahija, he continues to touch the lives of countless patients with his expertise and compassion. He stands as a shining example of a plastic surgeon who combines surgical skill, academic excellence, and a commitment to advancing the field. His contributions to both patient care and the medical community at large make him a true luminary in the world of plastic and reconstructive surgery. Dr. Millen, it's an honor to have you with us, sir. Welcome to the show.
Thanks, Farida. Thanks a lot. That was a wonderful introduction. At parts in that introduction, I didn't recognize myself, but thank you very much.
So that's all your contribution to this field of the plastic and reconstructive surgery. And I cannot say how many lives that you must have transformed. Uh, uh, I think that's the topic that we have chosen, the confidence that it brings about in people. So it's not just something that people would do, as I said, for aesthetics or just for the look, but for some, it's a matter of going back into the world and shining out.
Yes, indeed. See, plastic surgery is a huge specialty. It practically covers everything from head to foot, including hair.
Correct.
And there are many aspects of plastic surgery. The layperson sometimes thinks that plastic surgery is basically synonymous with aesthetic surgery or cosmetic surgery. But cosmetic surgery is just a small little part of plastic surgery per se. We have
Correct.
multiple subspecialties within the broad specialty of plastic surgery. We have hand surgery. We have what is called maxillofacial surgery, which deals with the facial skeleton. We have craniofacial surgery, which deals with the skull bones, especially in children who are born with certain deformities. We have burns, which is a very large part of our specialty is treatment of burns patients, and that is really really gratifying. We have cleft lip and palate surgery, again a very huge part of our specialty in especially in a country like India, in fact even worldwide. We have genitourinary surgery for certain genital congenital problems. So it's a very broad specialty. We have microsurgery, which has really transformed plastic surgery in the last uh, I would say 25 to 30 years, even more, even 40 years or so, because now we can put back and join back amputated parts. We can create transfer large sizes of tissue from one part of the body to the other. We also have reconstruction after cancer. So it's really, if you look at the specialties in surgery, plastic surgery is one of the really vast, and the spectrum of procedures in plastic surgery is absolutely huge. There is no part of the body that we have not touched as far as plastic goes.
That's so amazing, sir. So, how safe is this surgery, sir, according to you? Because some
Yes, it's
people
very
might
safe.
want to it, but yeah, the thought of,
Yeah.
or the fear that people have in their minds.
Yeah, so it's see, this is like any other surgery. What you have to understand is plastic surgery in certain areas is on the surface. It's basically the skin, the fat, and up to the muscle wall. So we don't enter inside the, let's say, the chest cavity where the lungs are or the heart is, or we don't enter into the abdominal cavity where our internal organs are. But on the face or inside on the skull where we have to go all the way up to the brain, we are of course always there. So, like any other branch of surgery, the same kind of health, the same kind of fitness is necessary for undergoing plastic surgery. It's no different. So, if your parameters as far as your blood tests, your ECG, your X-ray chest, and other things are normal, and you are fit enough to undergo plastic surgery, it's just like undergoing any other surgery, like say neurosurgery or cardiac surgery or urological surgery or anything else. So it's just the same. So it's very very safe. The important thing to understand is that there are certain practical aspects to plastic surgery where uh, you do not want to surpass that beyond a certain limit. So patients who have unrealistic expectations, uh, like for example, like looking like someone else or wanting to
Yes.
change their identity, those things are something that are taboo, just like in any other branch. They're taboo in plastic surgery as well, because that's not something that we ethical plastic surgeons like to do or want to do. So as long as you have realistic expectations, as long as you are trying to get back to as normal as possible, even maybe surpass the normal to a certain extent, it's very, very safe. But if you're unrealistic and your expectations are way too high, I think unfortunately it's not a good idea to undergo plastic surgery.
Yes, somewhere you're interfering with God's making then.
Exactly, exactly. I didn't want to bring God into science, but you are exactly that. You need to, you can't interfere too much with nature, and you cannot interfere with whoever is up there, the Almighty. So, but
Correct.
there is a lot we can do because of advances in technology, advances in understanding of a human anatomy, advances in understanding of how the blood supply to the human body is, etc., etc. So the branch has evolved significantly from the time when actually plastic surgery is born in India. We should be proud of that
Okay.
fact, and that was as long ago as the 7th century BC. Where there was a sage called Shushrut. You probably may
Okay.
have heard of him. A sage called Shushrut is the first person to, design and invent plastic surgical operations, such as replacement of a chopped off nose, such as moving tissues from one part of the body to the other. And he's written a magnificent treatise on plastic surgery called the Sushrut Samhita. It is still available. It is there on papyrus leaf. It's been passed down. So the birth of plastic surgery is in India. The father of plastic surgery, as we can call it, was Sushrut. But modern plastic
Oh,
surgery, as we know it now, evolved during the world wars because of the
okay.
the
Yes.
horrific injuries to patients, to soldiers, who became
Correct.
patients with deformities and mutilating injuries. That is where it evolved, and a large extent of that was contributed to by a person called Dr. Harold Delf Gillies, who was an English plastic surgeon. He used to be in the army, and he devised most of the modern procedures that are related to reconstruction in plastic surgery. Of course, we've evolved beyond that in the last 100 years.
Okay. So, doctor, what are the common misconceptions that people have about this kind of surgery, and how do we address them?
Yeah, so the first thing that I already mentioned, that people feel that with plastic surgery you can achieve anything. Those are unrealistic
Correct.
expectations. You want to change your features to look similar to one of your idols, maybe a Bollywood star, or maybe some kind of a rock star or something like that. There are patients who actually come to us wanting to change their identity, whatever their reasons to do that. So those certain things are not really par for the course. The other thing is
Correct.
that there is a great misconception that we use plastic in plastic surgery, plastic the material. I've had extremely educated people come up to me and ask me, and this is not a joke, कि डॉक्टर आप प्लास्टिक सर्जरी कहाँ यूज करोगे, आप प्लास्टिक कहाँ यूज करोगे.
Nice.
So the word plastic is actually from a Latin word plasticos, which means to mold, or
Okay.
that which can be molded, or that which can be reshaped. So, although arguably with the advancement in technology, we may use certain types of quasi plastic like silicon, or polypropylene and all that in our reconstructive options. Plastic surgery has nothing to do with plastic as we know it, not the plastic bags or the plastic bottles, that sort of plastic. So that's one huge misconception even among educated people. The third
Okay.
misconception is that, like I said earlier, once again, that a lot of people associate plastic surgery with cosmetic and aesthetic surgery, and therefore they feel that this is a surgery for the vain, the surgery of vanity, surgery which is restricted to only, let's say, the rich and the how shall I say, the bold and beautiful. But that is not
Correct.
so. Especially even in India, in the last 25, 30 years, we have found, and I will be very surprised. I do get my share of celebrity patients. Everybody does that. But you'll be greatly surprised that a lot of our patients are simple, ordinary, middle class people like you and me. Yeah, and
Correct.
they want to undergo plastic surgery because there is something called the body image. Uh, the body
Yes.
image can be something that wants, which figures that you want something better than what you have, to a reasonable extent, and you want to change it. So it may be a crooked nose, it may be a flattened nose, and you want to make that better. It may be a, a process of facial aging which you want to reverse to a certain extent. In women after pregnancies and after childbirth, you may have a lot of laxity in the tummy. There may be drooping of the breast and
Correct.
all that, and we can address that really very nicely. A lot of patients who are overweight want to lose that weight in a certain way. Of course, diet and exercise is the best way to do it, but we can also offer certain things like liposuction for that. So all those things together, patients, we have what is called typical male pattern baldness, where the
Okay.
male starts losing hair from the front and you only have a crown at the back. The success rate of hair transplantation surgery is of the order of 95 to 97%. And remember, it's your own hair which is replaced, or the own hair which is moved from the front back to the front. So it's a
Oh,
remarkable procedure to regain your self esteem, because a lot of men find that, as they bald, they find themselves a little, they have an inferiority complex, or they feel shy and
yes,
that sort of thing.
yes.
There are other things like where there is a development of breast-like tissue on the chest wall, which is called gynecomastia in males. A lot of
Okay.
these guys have this around the age of puberty, 13, 14,
Okay.
15 years old,
Yes.
and they are psychologically traumatized. These children will
Correct.
not go
Yes.
to school. They'll be teased by their classmates and their peers. So we have successful surgery for that, permanent successful surgery for that. So it's a whole gamut of things that we have to offer. Following injuries, following trauma, like I said, you have a chopped off finger, you have a chopped off thumb, you have a chopped off wrist, you have a chopped off limb up to the elbow, even up to the shoulder. If it's brought to us within, say, about 6 to 12 hours, we can put it back and it can regain practically full function. It may sound magical, but
Oh,
this has been done and regularly being done all over the world, including in India, including in Mumbai, for the last 40 years. We can
okay.
are very complex injuries where you have lost a lot of tissue, the bone is exposed, you have crushed injuries of the hands, the forearm, the legs, and all that. We are able to move tissue from one place to the other by using a technique called microsurgery, where the tissue is taken along with its artery and vein and nerve, and then it is joined to the artery, vein, and nerve in the area where it's supposed to go under the microscope, which is what's called microsurgery. So the stitches that we use are actually thinner than the hair that we have to join the arteries and veins and the nerves
Oh,
together. And you can transfer tissue like that. uh, any kind of injuries around the face, or like I call maxillofacial injuries, where you have fractures and all that sort of thing, we can put them back to make them look like that fracture had never happened. You can regain everything in your features, that your nose, your cheekbones, your jaw, your upper jaw, lower jaw, your forehead, your eye socket, everything can be reconstructed back. So there are a lot of things. A major component that I talked to about is cleft lip palate. A lot of these
yes.
parents are very guilty about it. They feel guilty ki,
Correct.
maybe genetically there is some problem with the mother or the father. That is not so.
Correct.
A lot of educated people have this misconception as well in cleft lip palate, that something as
Yes.
this child is deformed forever. Let me tell you that
Yes.
both in cleft lip and palate, if operated at the right time, we can make the child is normal. Let's not have a misconception about that. He only has this
Yes.
deformity where there's a cleft lip and palate. And cleft lip and palate
Definitely.
children, mind you, are more intelligent. This has been proved that they're more intelligent than other children. So it is just the
Oh,
deformity in the appearance. And we
correct.
are able to, by the age of a year and a half, we are able to do a succession of surgeries to completely bring that thing back to normal. By the end of
Yes.
maybe by puberty or so, it is almost impossible to tell whether this child had cleft or a cleft lip palate, or when he was born with a cleft lip or palate or not, because the surgeries are that good. So it's a huge spectrum of this thing that we can deal with, and the public needs to be aware of that. I'm sorry I went on and on, but I feel quite passionate about it, so I'm telling you all this.
No, sir, but I feel people need to know this because, as you said, the general misconception about and the main misconception about the surgery is that this is only for cosmetic looks,
Absolutely,
and only celebrities get it done. But people
absolutely.
don't realize that it is more required for people, as you mentioned, cleft lip. So I think again, talking about not only genetic, but uh, people over the years, have given very wrong conclusions that when there is an eclipse and the mother touches something, then that leads to
Yes,
it. So basically that builds up the guilt in the mother, because she feels that because of her carelessness the child is suffering now. And with such kind of surgeries, if the child is able to get back or become absolutely that thing can be eradicated, I think that's really wonderful. So hearing this, I think people should be more open towards such kind of surgeries and should inquire about these things in case they have such a difficulty or such a need.
Absolutely. So I always tell my patients, so unless you ask whether something can be done, you won't know about it. You
Correct.
may get an answer saying, no, sorry, we can't do much about it. But you have to ask. We are in the 21st
Ask.
century. You have to ask, because medical science, medical technology has evolved by such leaps and bounds that I don't think the day is too far when we are going to have what we call a bionic man, where we are going to be able to insert computer chips into people, and who knows, you know so
Yes.
unless you ask, uh, you will not be aware. So
Correct.
whatever misconceptions you have, they need to be cleared. Whatever problem a particular patient has, if he feels that it is related to plastic surgery, or even if it is not related to plastic surgery, the best thing to do is go to a qualified plastic surgeon, ask that person, get an honest opinion whether something can be done for this or not. And most of the time you'll be surprised that we have not just one but multiple solutions for this, to bring back whatever was normal, to restore what is deformed, to reshape, recontour, to rejuvenate. We have lots and lots of options now.
That's wonderful, sir. So, before the surgery, what parameters have to be normal before a patient undergoes such kind of a surgery?
Yeah. So there are two aspects to this, Farida. One is, of course, just like I said, because plastic surgery is like just like any other surgery. Although our
Correct.
incisions may be hidden, we try to make sure that our scars are not seen. They're as invisible as possible. We try to take incisions along what are called skin tension lines or skin relaxation lines, basically the folds in the skin and all that sort of thing. But it's like any other surgery. So you would probably do the same panel of tests that you would do for any other surgery, whether it's some abdominal surgery or whether it's a neurosurgery or whether it's anything else. So we would ask for a complete blood count, we would ask for a urine examination, we would ask for your blood sugars, we'll ask for your kidney function tests to see your protein levels, we'll see your bleeding clotting parameters, we'll see, especially in a female patient, whether the thyroid function is normal. We'll see whether the X-ray chest is normal, whether the ECG is normal, whether the heart is working well, that sort of thing. The second part of
Okay.
it is the psychological part, which I want to mention, especially in relation to aesthetic surgery, but also in relation to certain other things as well. Sorry about that. So we have also a component what is called body dysmorphic disorder, BDD we call it. It's a well-known component, and this is where the patient is a little unreasonable and has unrealistic expectations. The patient is normal, whether it's a male or a female, but for some reason he or she feels that there is something wrong with him or her.
Okay. Okay.
So very often these patients are red flags. They are a, what of a warning signal, because they want to go beyond the normal to something that we are not able to provide. And then these are the sort of unsatisfied patients. These are the patients who go into depression and all that after a perfectly normal surgery, after a perfectly normal result, because what they had anticipated and what probably the surgeon had not sort of managed their expectations, they'll end up with a result which they're not happy with. So before
Correct.
surgery, and this particular part, it's very important for an experienced plastic surgeon to identify this group of patients. It's not as if they are crazy, they're not mad patients, god forbid, that it's not like that at all. But they have a certain demand which cannot be met by plastic surgery, at least in the current scenario. So rather than dissatisfy these patients, rather than give these patients a result that they are which is less than what they anticipated, it is preferable that they undergo some kind of psychological counseling and all that sort of thing to manage their expectations. So basically these are the two things. The other thing that is a misconception is that if I have diabetes, no, I cannot be operated. If I have high blood pressure, no, I'm not for plastic surgery. If I've had a heart problem, I'm not for plastic surgery. That is not true at all. in the 21st century,
Okay.
because anesthesia now, anesthesia procedures have become so safe now. We have an entire panel of entire spectrum of subspecialties supporting us. Cardiologists, we have diabetologists, we have endocrinologists, and all that sort of thing. So your diabetes is under control, you are a candidate for plastic surgery, like for any other surgery. Your hypertension is under control with medication, yes, you are a candidate again for plastic surgery. If you had even an
Okay.
angioplasty, you are a candidate for plastic surgery. The one place where we are a little careful is where a patient has had multiple stents in CABG, where you have had heart surgery where there have been some multiple arterial bypasses have been done, bypass surgery as it's called.
Correct.
There we are a little careful. But other than that, most medical problems. And the other thing to understand is that some people say general anesthesia is dangerous. In fact, general anesthesia is the most safe form of anesthesia, because once you are put under general anesthesia, your breathing, your pulse, your respiration, your heart rate, everything is under control of the anesthetist. And with the modern anesthesia machines, they can practically control everything. So you are safe. If you are not fit for
Okay.
general anesthesia for some reason, many procedures can be done under what are called regional anesthesia, which means that you
Okay.
obviously all women know about spinal. They've had spinal or epidural anesthesia during delivery and labor. So we can
Delivery,
do it under
yes.
that, where only a certain part of the area is numb. We can do surgery under
Correct.
local anesthesia, where only around that area we inject local anesthetic agents and we do that. So you know a lot is possible, and only very little is not possible. That's the way I would put it.
That's amazing. And how does the recovery process look for patients who undergo such surgeries? Are there, again, some challenges for the recovery process also?
Yes, there will be some restrictions. Again, based on which area of the body has been operated, there will be certain restrictions. There will be maybe some restrictions on diet. If you've had facial surgery, you might be put on a liquid
Okay.
diet for 48 hours. If there is any intraoral surgery, it means that we have done something inside the mouth. You may be asked to stay on a liquid diet and gargle and all that for an extended period, 7 to 8 days or so. We have done anything on the neck or something like that, you might have a, what do we call, a compression garment, so that the skin can stick back nicely. If you have done any major surgery where the incisions are long, so for example like an abdominoplasty or any breast surgery, then lifting heavy weights, or maybe lifting a child that you have at home, or a certain way in which you get up from the bed, and certain way in which you lie back in bed, those may be taught to you for the first 2 or 3 weeks. It's never permanent. It's only in the acute
Okay.
recovery phase period. Let's say for example you have had an amputation of a finger, or your amputation of a multiple fingers or the thumb. Then for a certain amount of time you have to undergo physiotherapy after surgery, make sure that the function
Correct.
slowly comes back, that sort of thing. So those restrictions are there for a certain amount of time. But one thing I will tell you, in plastic surgery we try to ambulate the patient, which means we try to make the patient mobile, mobilize the patient as soon as possible. In fact, even sometimes
Okay.
as early as the same evening of surgery. Yeah, we at
Oh,
least make the patient sit up in bed, we at least make the patient walk, so that the circulation comes back around. There are no issues with any clots in the leg veins and all that sort of thing. So patient is ambulated, so
okay.
the restrictions are minor. And the restrictions
Okay.
usually are between maybe a week to 10 days for a smaller surgery or in a particular part, and up to about 4 to 6 weeks for a larger surgery. So 6 weeks is
Okay.
usually, I would say, a sort of a cutoff period. After 6 weeks, you are usually allowed to do most things. Certain very, very
Yes.
vigorous exercises or intensive exercises. If you have repaired a muscle anywhere, if you have, done any kind of repair to the abdominal musculature, for example, we may not allow for up to 3 months, because we want that repair to be strong enough. But other than that, most things are, in that period between 4 weeks to 6 weeks for even major surgeries.
Okay. So a patient goes back to normal life once in that complete recovery. Around 6 weeks, they
Oh,
are
yes.
back to a routine life that they can
Yes.
carry forward
Yes,
with.
yes. In fact, things like things in certain parts of the body where we operate, we give what are called supportive garments, compression garments.
Okay.
They are called. They may be for the chest, they
Yes.
may be for the abdomen, they may be even for the arms and all that sort of thing. And with that garment in place, you are able to do most daily activities even from the second or the third day onwards, with
Okay.
a few restrictions that I
With the
just mentioned to you, because we want
correct,
the
correct.
patient to be as mobile and active as possible. Remember, we are not going inside any body cavity. Yeah, we are not going into
Correct.
the chest, near the heart or the lungs. We are not going into the this thing. So we want to be sure that the patient's recovery is as quick as possible, although as safe as possible. So we have to strike a sort of a
Correct.
balance between the two, and we try to mobilize the patient as soon as we can.
Okay. And in all of this, doctor, according to you, what are the responsibilities of a patient following the surgery?
That's a wonderful question, and sometimes it frustrates us, to be honest. Uh, see, how shall I put it? Instructions post-operatively, especially, are given with a specific purpose. We know
Correct.
what can go wrong. We know what are the things that are can cause issues. We
Yes.
know what medications we need to give to tide over a period after surgery, whether it's antibiotics, whether it's painkillers, whether it's something for acidity, whether it's something to reduce swelling, whether it's something to enhance your blood supply to a particular part of the body, depending on what surgery has been done. So the patient's responsibility really is to follow those instructions. I would go even one step back. The patient's responsibility is to constantly question the doctor. It is the patient's right
Very true.
as well as responsibility to question the doctor, because it's his or her body on whom the surgery is being done, and it's the
Correct.
patient's right to know what is going on. And very often we find that, especially in the larger hospitals, patients are afraid to question the doctor. Well, I don't know. I at least
Yes.
come from the generation of doctors who would welcome questions from the patient, who would want to be as transparent with the patient as possible, who would try to even explain complications to the patient upfront, because complications happen.
Correct.
There are problems
Yes.
that happen with every surgery. Even with the best of intentions, you operate, there are likely to be complications. But as long as you're transparent with the patient is reasonably happy, because you know, you and the patient are taking that journey together, and the doctor is likely to be with you till the end of that journey until he's fully recovered and rehabilitated. So that it's the responsibility of the patient to ask questions at every stage. Why is this being done? Why is this test being done? What are you going to learn from this particular test? Why am I being given this compression garment? Why am I being asked to be mobilized? Why can't I lie down and sleep and relax in bed? So everything has a purpose to it. Why am I being given antibiotics for 7 days? Why is this tablet given to me in spite of it's causing some bloating? Is the benefit more than the issue as far as bloating is concerned? Yes, it is. That's why you're being given the tablet. And of course, then to follow regularly with the doctor or the surgeon as and when you are called. Because, like I said earlier, the acute recovery phase in all surgeries, all I would say across the spectrum of surgical specialties, is usually about 6 weeks. So it's the
Correct.
patient's responsibility to come back for follow-ups regularly for at least those 6 weeks.
Correct.
If the patient is
Yes.
unhappy, let me tell you, the patient always comes back. We don't have to tell the patient. If the patient is happy, also the patient sometimes doesn't come back after 6 weeks. But I have never seen a doctor who has not wanted to get as long a follow-up as possible from a patient. So any patient who comes to us at 3 months, 6 months, 1 year, I had a patient today who came to me after a breast reduction after 6 years. I cannot tell you how
Oh,
happy I was to see her. She just came to just see, doctor, everything is fine, everything is good. I said, so and so, I'm so happy to see you. You are one of the few patients who's come back to me after 2 years. You have 6 years after surgery now, and I'm really happy to see how everything has turned out. So those things matter as to the doctor as well.
correct. So, as much as it's the doctor's responsibility, I think it's a journey for even the patient. So, it is their
Abs-
responsibility also, first of all, to be informed and to follow all the guidelines correctly.
Absolutely, absolutely.
Correct. And, doctor, are there any recent advancements, which I'm sure must be, in the techniques and technologies that have improved the outcomes of such surgeries?
Oh yes, yes, absolutely. Across the spectrum. Once again, like I said, I used to be associate professor in a teaching institution, so I could probably take a 1 hour lecture on this only, on advancing technologies. But I won't. I promise you. So right from head to toe, there are advances in technology. You heard of robotics, so there is robotics technology in our field as well, in how to do things like hair transplants, in how to harvest what are called flaps, in how to do join arteries and veins, that sort of thing. There are other technologies related to what sort of modality we might use in liposuction. For example, we have
Okay.
ultrasonic assisted liposuction, we have laser assisted liposuction, we have plasma helium assisted liposuction, we have water jet assisted liposuction, all of which makes the experience little less traumatic for the patient as well as for the surgeon. It reduces the bruising, it reduces the swelling, it reduces the recovery from the post-operative period. We have a lot of non-invasive technologies now related to like intense pulse light, what is called high frequency ultrasound. We have Botox and fillers instead of undergoing surgery in a younger patient. uh, a lot of things. We have what is called cool sculpt, which helps in if the fat deposits are a little less than otherwise treatable with liposuction, there's a non-invasive technology which sometimes does help. There are a lot of things. There are things for facial rejuvenation where there are machines which help you for the skin to tighten, because as you grow older the
Okay.
elasticity of the skin becomes less. So not in every case
Yes.
the skin will shrink and it become tight enough after surgery. So we have what is called body tight and face tight. These are machines now which help the bodies to shrink. So a lot of technological and uh, technology in plastic surgery, as in any other field, you will find that in 2 years, the previous technology, which we considered new 2 years ago, has now become obsolete. Not quite obsolete, but something new has come,
Come
which
on.
has more benefits. Of course, it is also expensive when you start off with it. But if we find that the benefits far override the costs, then some surgeon will adapt them and make sure that he or she gains enough experience with it. So there is a tremendous amount. There is also what is called tissue expansion, where earlier, if you didn't have an adequate amount of skin in a particular area to cover a certain wound, we have what are called silicone balloons that we can put under the skin, and those balloons are slowly inflated. These are not the balloons that you get at beaches and chowpatis. These are the balloons which cost around 20,000 rupees. They're made of silicone, and we put in saline infiltration inside them, and we just stretch. So the skin stretches. So over a period of
Oh,
3 weeks, 4 weeks, 6 weeks, you're actually getting double the amount of skin that you started out with, because the skin stretches out. So if there's a wound nearby and you want to cover that wound, or there is any kind of scar nearby, or any kind of congenital patch or something like that nearby, because the adjacent skin has been expanded now, we can just cut out that particular part which is deformed and just move that skin. So lot of such things are also available. So, like I said, if you don't ask, you won't know. Lot
correct.
of lot of advances.
And where do you see the future of plastic and reconstructive surgery going on from here further?
Well, see, the basic foundation of plastic surgery is not going to change. The basic foundation of
True.
plastic surgery is related to respecting tissues. The human body is absolutely wonderful. It's only when you enter medicine and you actually, in your first year of medicine, you dissect the human body and you see the muscles, the arteries, the veins, the bones, and how they are arranged. If you're an atheist, you start believing in the Almighty. A further this thing beyond that is when you see the world under the operating microscope, how the arteries and the veins look when they are magnified under the operating microscope, how everything looks as if somebody other than uh, somebody divine has actually done this. I'm not trying to plug religion here, or I'm not trying to play religious here, but there is some
Correct.
higher authority which has done this. So tissue respect, how to how to handle tissues, how to know the anatomy of the human body will always be the basic foundation. Technology to a certain extent will take over because it makes some procedures easier. It makes it easier for the patient. It reduces the post-operative phase in terms of how quickly you recover. It makes things easier for the surgeon, especially if he's well trained in that particular technology. One thing I will say is, you mentioned a particular play thing called autologous fat grafting in my when you
Yes.
introduced me. Now we
Correct.
have a byline in plastic surgery. We say fat is the future. Now, fat is the
Okay.
future doesn't mean a fat person is the future. It's not like that. It means that human body fat is the future, because it has tremendous rejuvenative properties. It has properties of healing beyond what we have ever thought of or imagined until the last 20 years. I'm sure
Oh,
you heard of breast implants, that we people put breast implants to do breast enhancement of the breast size. Breast implants have
correct.
been there for the last 60 years. the science of fat grafting, meaning taking fat from one part of the body and putting it in another part of the body, the same person, your own body from one part to the other, has been there for the last 20-25 years. It's your own fat. It cannot be rejected. It cannot have too many complications. The body will accept it. And if you understand, as a layperson's logic, you have certain areas in the body which are called stubborn fat. People come to and say,
Okay.
डॉक्टर मैंने इतना एक्सरसाइज करके देख लिया लेकिन यहाँ से तो फैट जाता ही नहीं है. That is called stubborn fat, and it's true. It is stubborn fat. So there's a theory
Correct.
which says that if I take fat from that area and I put it elsewhere, that fat will survive much better than any other fat. So I might take fat from your tummy, I might take fat from the thighs or the buttock area, and I might use that to enhance the breasts. I may not require
Okay.
breast implants to increase the size of the breast in another 10 years. The breast implant industry may completely go out, because now I'm using something which is not a foreign body, but I'm using something which is from your own body. Because
Own
remember,
body.
the female breast is anyway 60% fat. It's your own fat that forms it. So if you're taking fat from somewhere else and putting it there, it's the most wonderful thing. Fat also has what are called stem cells. Sure, everybody has heard of this thing called stem cells. Now,
Yes.
stem cells are what are called pluripotent cells, which means that when they're taken from one part of the body and placed somewhere else, let's say they're taken from the tummy as fat cells and they're put into the knee joint, where there is a lot of cartilage and bone that is there. If the cartilage in that knee joint is needs replacement, sometimes these fat cells, the stem cells in the fat cells will transform into cartilage cells. if
Okay.
if you require bone cells, sometimes the stem cells will transform into bone cells. You can put them into the bone marrow, take them out from the bone marrow, inject them somewhere else, and they will transform into a different type of cell, and they will help in healing, they will help in restoring that particular part of the body. The science is only 20 years old, but this is going to be the future. Even in the thinnest patient, fat is in fair abundance. You can always get fat in even the thinnest patient. Yeah. So
Okay.
this is one of the branches that are likely to be the future, and it's called autologous fat grafting. Autologous means same. You're taking it from the same person,
Okay.
using it in
Same.
the same person. Auto. Yeah. So autologous, and fat grafting is self-explanatory. So this is something that we are very excited about, and I think this is going to be one of the parts of the future in plastic surgery, and it's going to go across the entire spectrum. It's not just aesthetic surgery or cosmetic surgery it will be used for. It will be used in a lot of other things as well.
That's so wonderful to know. Amazing insights that we are getting to know here. So, Doctor, lastly, what advice would you give to someone who is considering such kind of surgery? Of course, you've told us about what misconceptions people have, what kind of recovery process should they be prepared for, what kind of parameters that they have to be keeping in mind. But still, if a person, let's say, is planning any kind of corrective surgery or plastic surgery, so what advice would you give them so that they can regain their confidence and they can improve their quality of life? Because I feel sometimes people also are hesitant, as you said, not only to ask but also to take the first step and come to the doctor for various reasons. It may be the cost factor involved, or it may be just that shy feeling that, then I'll have to tell people that I've undergone a surgery or anything as such. So what kind of advice can you give to such people?
All right. The first thing I would say is that if you have a particular problem that you think is related to plastic surgery, uh, you must ask around whether something can be done about it. I've already told you about that. The
Yes.
next thing is that you must approach a qualified plastic surgeon. So a qualified plastic surgeon, especially in India, but even across the world, would be somebody who has a particular degree, who is qualified in plastic surgery, and therefore, because plastic surgery training is extremely extensive. To become
Okay.
a plastic surgeon, you have 6 years of 5.5 years of MBBS. Then you have 3 years to become a general surgeon, and then you have 3 further years before you become a qualified plastic surgeon. So by the time you become a plastic surgeon, you have gone through 11 years of medical training. 11 years of medical
Oh
training.
my goodness.
Yeah, yeah. So every single qualified plastic surgeon on this planet has gone through that, or even more in certain other countries. So you must go to a
Correct.
qualified plastic surgeon. If I have to talk about India, there are organizations or there are associations to which these plastic surgeons are affiliated to, And if they are a member of these organizations, for example, uh, our parent body is called the Association of Plastic Surgeons of India, APSI. So if a
Okay.
plastic surgeon is a member of APSI, you can take it practically for granted that this man or this woman is a trained, qualified plastic surgeon. We have an
Okay.
organization called the Indian Association of Aesthetic Plastic Surgeons, IAAPS. A person is
Okay.
a member, that person has been vetted. He has been his qualifications have been seen by his peers, and only then he's given membership. So you know that if this person is a member of the Aesthetic Plastic Surgery Association, he's a qualified cosmetic or aesthetic surgeon. And the
Okay.
same for other associations across the body. For example, I'm a member of this association called International Society of Aesthetic Plastic Surgery. This is a society which contains qualified plastic surgeons, who admits only qualified plastic surgeons from across 192 countries around the world. So
Oh,
if a
wow.
person is a member of ISAPS, or the person is a member of this particular organization, you know that he is a qualified plastic and cosmetic surgeon. That's the first thing.
Okay.
The second thing is that once you approach a particular person, you must find out how specialized or how experienced he is in that particular field, because I already mentioned the subspecialties. As we have come into the 21st centuries, a lot of plastic surgeons, maybe my teachers were general plastic surgeons, they used to do everything. But more and more
Okay.
now, plastic surgery is breaking up into, not breaking up, I would say, but people are going into multiple subspecialties.
Specializing.
So you find that
Okay.
90% of my work is as a cosmetic surgeon, so I do mainly cosmetic surgery. There's somebody else who does only hand surgery. There's somebody else who does only cleft surgery. Not only, but majority of his work is cleft surgery. So obviously, with more experience in that particular subspecialty, that person is going to be much better for you as a surgeon than somebody else. The
Correct.
other thing is that seniority is just seniority. I'm very, very passionate about saying this, and I'm not liked in my own association for saying this. Seniority does not translate to competence. Seniority only means that you have become older in age. Yeah.
Correct.
So you must find a surgeon who answers your questions, whether he is 30 years old or he's 40 years old or he's 50 years old or he has gray hair like me, and satisfy yourself that this is the surgeon for me. The
Correct.
patient should take, if necessary, the patient can take a second opinion from somebody else, take a third opinion. One further, I won't say warning, but one further caution that I would put and request I would put to our listeners and our viewers here is, do not rely on Google. A lot of people do Google searches, and they come up with their own self diagnosis, their own sources of information. It is all right as a preliminary source of information, but let that not
Yes.
be the sole source of information, because a lot of information out there is wrong. Not only that, a lot of information out there makes you think that this is a walk in the park. A lot of lot
Correct.
of lot of plastic surgeons will tell you, yeah, come and do liposuction, aaj subah mein aap karo, you do it in the morning, I will send you home in the evening, day after tomorrow you're back at work. No, it is not so. It is a process. It's a process for your own good. It's a process
Correct.
where the doctor tells you and gives you instructions to make sure that your recovery is as uneventful as possible, that it is as smooth as possible, and it's as pleasant as possible. So
Correct.
make sure that you do your homework, make sure you go to the right person, make sure that your questions are answered, make sure that you go to a person who has sufficient experience and is a qualified plastic surgeon, and you will find that overall there is much more that that is available in plastic surgery than you can imagine. In fact, there are some of our own colleagues, maybe some senior ones, who are not aware of the latest advances. And the other thing is that not all advances are good for the patient. Remember, these are
Okay.
companies with these advances. So unless it has been proven in a certain number of patients, unless it has been proven not to have side effects, unless it has been proven not to have complications, jumping to this just because it is mentioned on Google as the latest technology is not the right thing to do. So you must keep your
Correct.
eyes open, you must keep your mind open, and you must do your homework before you go in for any of these surgeries. And you will find that if you do that, you will have a fantastic result, and you will be happy that with your decision that you undertook plastic surgery.
Correct. So I think, again, once the crux is that be well informed and ask questions.
Absolutely,
That's
absolutely, and it's your right.
very, very
It is your right to ask questions and be satisfied with the
yes,
answers.
correct. Yes. So, Doctor, once again, thank you so much. Whatever you have shared today, I guess it is definitely going to make a lot of difference and clear a lot of misconceptions which people may be having related to this field of plastic and reconstructive surgery. It will get the confidence in people to come out, share their problems, get medical opinions, and get back the confidence which might have gone missing due to some problem or the other. So, once again, thank you so much for all of these insights, sir.
Thanks, Farida. Thank you so much for having me, and I hope I was able to do justice to some of the questions you asked me. And I'm available and at anybody's service. If anybody wants to ask me, I one thing I can definitely promise uh, is that I will give an honest opinion. That is the USP of my practice, and that is the USP of my philosophy, and that is what I am known for. I think I will give an honest
Yes.
opinion, including I don't know if I don't know. Yeah.
I think that takes a lot to say this. That because most of the people, not only doctors, but for people who are senior or at any level, would never want to admit that they don't know something. Maybe they might come up with answers which are unsatisfactory, and most of the times what happens is the people who are sitting across may not be able to cross question because they are already intimidated by the person sitting around them, so they would not want to go back and ask or clear those things. So it takes a
Yes,
lot to say
that's
this.
thank you. Most kind of you.
In conclusion, the world of plastic and reconstructive surgery is a testament of the remarkable blend of artistry and science, compassion and innovation. It's a field where lives are rebuilt, where hope is restored, and where the beauty of transformation goes beyond skin deep. We got to know such invaluable insights from Dr. Millen, who makes these transformations possible and explored the cutting edge advancements shaping the future of this discipline. As we wrap up this journey, we hope that you've been inspired by the resilience and strength of those who have undergone these life changing procedures, and that you've gained a deep understanding of the incredible work being done in the realm of plastic and reconstructive surgery. Thank you for joining us on this voyage of restoration and renewal. See you all next time in another episode of The Professional's Pass. Thank you so much. Thank you, Doctor.
Thank you. Bye bye. Take care. Stay safe.